word from Carlos, this is good. You're barely holding out. They got half the Cuban army down here. And those B-26s ain't hitting anything. Moving to the main hallway.
Okay, we're on our way. Move up. Ben, take the right.
Roger that.
Down! Hostile down! Push forward! He's dead! Get the cover! Hostile in the barrel! Hostile down! Tossing it back!
What you're about to watch is done a bit differently than any of my other videos. I'm setting aside all the bells and whistles and will be speaking to you about a growing problem that either you or someone you love might be facing, and that is gaming addiction in children. This is also referred to as several different things, such as internet addiction or electronic screen syndrome, but regardless of what term you use, the problem is still the same. In this video, I'll be discussing how to know if your child has a gaming addiction, as well as what resources you have. While I'll be speaking with experts in this field, I myself am not a medical doctor. I have no formal medical education or training. That is something I want to first make clear. I am not a doctor, which is why I brought in experts who are doctors and have decades of experience studying and dealing with this specific issue. Being a father myself, I understand it's hard to know exactly what your kids are doing at any given time. It can also be frustrating just trying to keep up with the latest technology and trends affecting your kids. But during the next few minutes, I'll provide some insight on what you can do to determine if your child has a gaming addiction and what tools you have at your disposal to combat this in an effective, caring way. Depending on your age and where you grew up, you may or may not have been exposed to video games. Many people becoming parents today grew up both at a time and place where video games were first taking hold in homes across America, Europe, and parts of Asia. Each continent had their own dominant gaming systems, which in terms of gaming addiction is irrelevant. When everything's said and done, you as the parent know what is best for your individual child. Not all children respond or behave the same way after exposure to the same elements. Just remember to treat gaming as any other issue with your child. Just do your best to stay informed. Like I mentioned a few moments ago, I am not a medical doctor of any kind, nor am I pretending to be. I do have some guests whom I interviewed that are all respectable medical professionals in their field.
I'm Dr. Kimberly Young, and I'm the founder and director of the Center for Internet Addiction Recovery.
I am Dr. Victoria Dunckley. I am an integrative child psychiatrist, and I've been practicing psychiatry for over 15 years and working on screen time issues for over a decade.
My name is Howard Scott Warshaw. I'm the Silicon Valley therapist. I am a licensed marriage and family therapist in California, where I practice and I specialize in high-tech people and the issues that befall them. I also work a lot with super intelligent.
In today's world, it's nearly impossible for your children to not be exposed to electronics of some kind. I think there is a consensus that too much exposure to electronics in general is not good for children or anyone. But just how early is too early to actually expose them to any of these devices?
Well, as a child psychiatrist, I really see no reason to introduce them early at all. There's really no justification for it. They're going to learn children learn technology very easily and rapidly, as we all have seen. So, even if they're held back from it completely, it's easy to catch up later. It's not easy to catch up on developmental milestones. I'm one of the more conservative people on this topic, but I just feel like we should withhold technology exposure as long as possible and introduce it at a time when they're more developmentally ready.
Well, how young is too young is sort of the new question, where before it was how much was too much time, and now it's how young is too young. There's no real cutoffs. I mean, those are debatable issues, if you will. I mean, the American Society for Pediatric Medicine, I think, promotes more about under the age of 2, there's no technology use. I tend to say much more about conservative, I guess, under the age of 3. And to the extent that I think children need to develop their motor skills, I think they need to also develop other sensory kind of ways of learning in terms of what they see and what they feel. And what happens is if you start a child too young, then they don't want to play with any other toy. They just want the tablet. They just want the device. And they get very sophisticated very quickly with those tools. But on the other hand, then they don't want to play with Barbie or any other kind of toy that might seem pretty boring now. I mean, when we were of a certain generation, those were great toys. But now with technology, you have this big competitor because it can do so many cool things. So I say try to wait until at least the age of 3 for technology to be involved in the child's life. And even then, be very careful about what kind of technology. I mean, there are some wonderful like educational toys that are technology based, but really still trying to promote creativity in a child. I mean, good old fashioned coloring books and just basic tools that get kids thinking for themselves, encouraging reading at young ages. That's very important too, because what happens is if they read everything just off their device, it's more of a scrolling, scanning activity with sound bites, if you will. Brief periods of information or brief bursts of information. Where reading a book, it's much more linear. You have to go page by page, line by line. And it also requires a certain level of concentration that reading off tablets and devices do not. So I really emphasize trying not to read off tablets until, again, the child's much older. I think we have a whole new age of parenting out there, because this wasn't a factor years ago, but now with the upcoming generations, it certainly will be.
Unfortunately, as with most things in this sort of area, it is very hard to come up with blanket statements that cover everything. One of the problems that I think we deal with today in trying to deal with game addiction, or a lot of the issues that we have, is people are looking for silver bullets and solid golden rules that they can follow, and they just don't exist. If you really want a generalized rule for how young is too young, okay, too young is before their sense of self is formed, before a sense of responsibility is formed, before there's an understanding and a capability of beginning to manage the device. Those are the things. Now, when that occurs in each individual varies depending on the individual, and also depending on the parenting or the environment in which the individual is developing. So what age is too young to be using an electrical device? I think the real question is, at what point is a person prepared to not be taken advantage of by the device they're using? And I think, as we've seen in recent history, there's no age that's absolutely there, because there are full-grown adults that still can't really manage their devices reasonably.
When you do start to incorporate electronics to your child, one thing numerous experts advise is to play the game with your child. Not only will that give you the opportunity to observe their behavior during gameplay, but it can also serve as quality time together. There's even a badge in Cub Scouts now that encourages this. The idea is to use that time to bond and teach lessons relevant to the particular game.
So what I tell parents is, if you really want to work with your kids and deal with them around games, the first thing you need to do is play the games with your kids. You need to get in there and do it. If you forbid it, what you're going to do is they're going to play them anyway, and you're just not going to hear about it. Here's a question for you. When are people able to differentiate between fantasy and reality? The ability to differentiate is something you learn. That's why little kids' stories of fantasy and things like that are so popular with little kids, right? Because for little kids, it is real. Kids do believe in Santa Claus. Kids do believe in the Easter Bunny for a while. And then they come to a point somewhere where they realize, oh, those things are just fictions, and I get the difference between real life and the fiction, and that's okay. And then you can play with the fiction because you know it's not reality. People who don't have that difference, it's a very different experience for them. And those people can feel they're learning about reality from fantasy creations, like movies, like TV, and like games.
I know many parents don't have the time or ability to engage with their child while they're gaming. If there's a trusted adult who could participate with them, I recommend them doing so. Participating with your child while they're gaming will accomplish several things. First and foremost, it will allow you to enforce time limits for your child to be gaming. It will also allow you to interact with them, not necessarily about gaming. This is a perfect time to ask about new friends, what's going on in school, etc. What constitutes an addiction? In broad terms, it can apply to a number of different behaviors, but typically only becomes a problem when the amount of one's time spent engaging in it would be considered excessive. To better understand this, let's discuss exactly what addiction is. Addiction can describe any behavior or substance that gives the user euphoria and relief when engaging that behavior or substance. The absence of that behavior or substance leads to withdrawal or unpleasantness for the user to a degree that negatively affects the other aspects of their life, such as family, work, or school. Determining whether your child has a gaming addiction is very similar to determining if people have other addictions. As a parent, it's important to keep an open mind on the possibility that your child could have a gaming addiction. It's not a failure on either your part or theirs. Being an enabler for a child with a gaming addiction is just like being an enabler for anyone else with any other addiction. Believing that's just a phase and that they'll grow out of it is a lot like saying someone with a gambling addiction will just grow out of it. One behavior your child will express if they have a gaming addiction is something called flow. Flow is something that many addicts exhibit and is a feeling the user experiences that causes them to completely immerse themselves in the game or activity, while also causing them to lose awareness in their surroundings and other things that should be important to them. This behavior can lead to inactivity and social reclusiveness. This can also lead to failing grades and lack of motivation. With older teenagers, it can hinder them from getting a job or even going to college. There's also physical changes that occur when someone engages in active gameplay.
So basically, every time a child picks up a device and starts interacting with the screen device, the nervous system or the brain interprets this as a form of stress and goes into fight or flight. And it actually does this by a number of different mechanisms. One is that the reward pathways are activated. So dopamine gets released in a very intense manner, and the reward pathways get activated and eventually get desensitized.
What's interesting is there's becoming a whole new line of research on the neurobiology of internet addiction. And with that said, it's really only been done with 18-year-olds and up. I'm not familiar with any study that looks at children specifically. So in that context, though, we see that dopamine has been a very significant factor with, elevated dopamine, which is sort of a pleasure kind of neurotransmitter. So it's consistent with research that's been done on other addictive behaviors. So we understand that there's something pleasurable about addictions, whether it's to drugs, alcohol, or the internet, and it's consistent in the body. So there is some kind of brain change.
Dopamine is a chemical in your brain, and that's the chemical that says, wow, this is great, this is fun, I'm loving this, I'm enjoying this. It's a wonderful, wonderful chemical to release in your brain. It's so nice, in fact, that if we get enough of it, or a little too much of it, we can really become addicted. Dopamine plays a key part in the field of addictions because most addictive behavior comes down to the stimulation of production of dopamine in your brain, which makes you feel good.
There's also the very intense sensory stimulation. So there's bright light, vivid colors, rapid movement, all of that the brain must process, which also raises arousal levels and fight or flight chemicals. Then there's also the blue light itself, which tells the brain it's time to stay awake, it's daytime, time to be on the alert. And that actually disrupts the body clock, suppresses melatonin, which is not only important for sleep, but it also is important for controlling inflammation and hormone regulation.
They also look at increased activity in the prefrontal cortex of the brain, again, where things like planning, judgment, impulse control, and the limbic system sort of are housed, and that being related to our emotions. So we see that somehow with overactivity of, say, internet technology, those that seem to have real addiction problems, maybe it's to gaming, then we see increased levels of dopamine, we see increased levels of activity in the prefrontal cortex. You also sometimes, see there's some newer even genetic studies finding like the same genomic type for things like smoking as an addiction. It could be correlated with internet addicts as well. That's newer and less identified, but I think those are some of the more biological issues going on.
With heroin, it's an easy thing to see, okay? So how does that happen with a phone? Let's say, hypothetically, I'm a teenager. I'm an early teenager. And one of my primary goals in life at this point, one of the major challenges that I face developmentally in my life is to fit in. I need to become and beginnings of an adult, I need to start realizing who I am and start cultivating and really defining my identity. And I'm doing it in a social environment. I am now becoming more and more aware that there are peers, there are other people around me that form this social network I'm a part of, and I'm seeking acceptance within that network. That's a very important thing for me right now. Now here comes the phone. The phone proposes a social network, a social app, okay, like a Facebook or a Twitter. And what that does is it tells me that when I put something out into the network, which used to be having a conversation, but now it's just putting up a post, and it's got a scoring system built in that will tell me how I'm doing. And if I put something up and it gets a lot of likes and a lot of recognition and a lot of hearts and stuff, that's great. And I know I'm doing okay. And if it doesn't, well, that can feel like rejection. Another thing is, suppose I put a message out and no one contacts me, no one calls me, no one responds to me. Well, now I'm socially isolated. So now with phones, anytime, 24 hours a day, I can be engaged in this experiment of finding out if people are liking me or not, if they're responding to me or not. And I get to the point where every time your phone beeps, every time it lets you know something's happened, when you get a notification, a little bit of dopamine that gets released in your brain. It's something that goes off and says, yes, there it is. I feel better. At least I'm not a social outcast. I know that someone cares about me. It can get to that level in someone's head. And if you don't get the responses, then you're sitting there waiting for your phone to buzz.
Interactive screen time is much more stimulating than passive screen time like watching TV. So all of these things kind of combine and contribute to that fight or flight response, raise arousal levels, and that puts the brain into a state of stress and eventually chronic stress, which ends up affecting the brain's frontal lobe.
Too much exposure to electronic devices does run the risk of hindering much-needed brain development in younger children. There is something available called the Screen Smart Guidelines. This uses an age guideline of 3, 6, 9, and 12-year-olds as a way to measure how much screen time a child should be exposed to. While age is obviously important, is the type of electronic device your child uses equally important?
The other issue is passive versus interactive screen time. So, typically we think of, well, at least if they're interacting, it's better than just sitting there like a couch potato while they're watching TV. But actually, because they're interacting with the device, it's actually more stimulating and can be more dysregulating. So we know from some of the studies that children are more likely to have sleep issues, mood problems focusing with interactive screen time a lot more easily and quickly than passive screen time.
When it becomes interactive, we engage it at a level that's much deeper and much more involved. And when the device can start to motivate us and start to signal us when it's time to interact, as opposed to us deciding when it is to interact, and when the neurotransmitters, when some of the reward systems in our brain start getting hooked into that signal system, that's when an active device can take us over in a way that a passive device never will.
While most people will agree that exposing young children to violence causes them to mimic that violence in some manner, there's one viewpoint from Dr. Dunckley that takes that approach a step further.
They're still going to get stimulated from a Sesame Street game. It may happen more quickly with a violent video game, but it's still the same mechanisms are going on behind the scenes. So if a child's playing educational games every day, they can still easily become dysregulated. I see a lot of patients that's the only time of screen time they're allowed is educational screen time, and they don't even get that much. But then when you remove it, you can see a big difference in their behavior and their focus and emotional regulation.
In many cases, parents and older siblings have an enormous effect on the habits, both good and bad, of younger children. This includes our own electronic habits as well. When your family's at the dinner table, is everyone checking email and status updates on their phones? Or does your family even sit down at the same table for dinner?
The parents' screen habits have a huge impact on the child's screen habits. First of all, there's modeling. So for many things in parenting, however the parent acts, the child is likely to act the same way. So that's one major area. But the other thing that parents don't often think about is that when a parent is using a device, they're trying to interact with their child, their attention is divided. So the child either feels ignored or they don't have the parent's full attention. And that can create problems in itself because the child's just constantly getting these little rejections. The other thing is the parent isn't aware of things themselves. So they're not as emotionally in tune with the child when they're using a lot of screen time. They're not as able to follow through on things such as discipline. They're not able to look at the child's behavior in terms of the child's screen time. When the parent is trying to regulate the child's screen time, if the parent is on the device a lot, it's a lot harder for them to monitor the screen time, be consistent, notice when behaviors get better or worse, etc. So it makes a huge impact.
Who helps children differentiate between fantasy and reality, right? Parents. Parents are the number one vehicle for helping kids establish. You know, it's one of the big questions. When do you tell your kids that the tooth fairy isn't real? You know, when do you tell your kids certain things are or aren't really happening? Okay? That's always a big question in parenting. But what that question really says is, I'd like to do the best job I can helping my child learn to differentiate between fantasy and reality. But the one thing that's for sure in this whole puzzle is that if I'm in touch with my kids and I have a good relationship with my kids and I can communicate with my kids, I have a much better chance of helping them get there than if I have taught my kids not to communicate with me, to hide from me, to shut down from me. And a lot of parents end up taking that approach. That's not their goal. That's not how they set it out. But it's a very predictable result from some of the rules they create.
If your child has developed a gaming addiction or any addiction of some kind, they'll exhibit some of the following behaviors and characteristics: obsession, compulsiveness, physical or psychological dependence, and frustration or anger while not engaging in the addicted activity.
If you were to flip through the diagnostic manual, you'd see that pathological gambling and internet use disorder are highly the same. They're highly correlated. I mean, you see a loss of control, you see a loss of interest in other activities, and increased, problems because of the behavior. I mean, at a core, addiction is addiction. I think the issue is how it manifests for each person. Now, as far as children, I'm not sure if there's any specific studies with gambling in children. I think there are some studies that have really shown, and my own included, that in particular with online gambling, teenagers are more at risk because they have easier entry versus going to a casino where they can't get in because there's ID required. But under the age of 18, lots of teenagers can now go online to game and gamble and sort of circumvent because there's not really a bouncer at the door. And I saw a lot of problems with that.
Okay, well, what we're talking about is addiction in general, okay? Because there's nothing really magical about video game addiction, okay? Video game addiction is what I would call a behavioral addiction. There's two basic classes of addiction. There's substance addiction and there's behavioral addictions. Substance addiction with things like crack cocaine or heroin, any human being, if you give them enough of these things, they will become addicted, right? And they will have the symptoms of addiction. And the principal symptoms of addiction are what's called tolerance and withdrawal, okay? Which means you can tell you're addicted when, first of all, each time you try to consume the substance, you need more of it to achieve the same level of satisfaction. That's called tolerance. You're building a tolerance to it. So it takes more to get the same effect each time. And the other symptom is withdrawal, right? It means when you take the substance away, there is a notable negative experience or reaction.
Jesus Christ!
Somebody help us.
I need a doctor, man.
My friend is sick. We need some help, please.
I can't take
Somebody
it,
help
man.
us.
My arm! My f***ing arm!
Just hang the fucking top.
No, man!
Help us! Somebody help us, please!
So people know about heroin withdrawal and stuff like that. It's tough. Caffeine withdrawal. Some people, they forget their morning cup of coffee and they get a headache. That's someone who's addicted to coffee. because their body has adjusted to a point where the presence of the substance is now more normal than the absence of the substance. Because your body always signals you when something's out of normal, but you can shift what normal is. So when you've shifted yourself, when you've gotten to the point where not having the substance triggers a negative reaction in you, well, now you're addicted, because addiction means that the substance has now become a normal, natural part of your existence. Something that wasn't originally, couldn't possibly have originally been a normal, natural part of your existence, has become that, and you have adapted to it to the point where you're dependent on it, and that your body signals you when it's not there. And anxiety and stress are two of the real major signals in things. So let me go back. Substance addiction is a thing where any human being exposed to this substance will get addicted, right? And that's usually chemical. Now, behavioral addictions, we hear about gambling addicts, sex addicts, love addicts, and game addicts, okay? You can always spot a behavioral addiction because not everybody who uses the substance gets addicted, right? That's what makes it a behavioral addiction. Now, a substance addiction is really about the substance. That's what a substance addiction is. Behavioral addictions are more about the person, and some people are more susceptible to it than others.
The presence of chronic stress causes the body to direct blood flow from the frontal lobe of the brain, where the more complex higher thinking occurs, and towards the areas of the brain geared for primitive survival. This lack of blood flow in the frontal lobe can cause impairment and lack of judgment, and that is what it does to fully developed brains in adults. Imagine what those same actions do for the developing brains of children and teenagers. Even the nervous systems of children are still developing. The chronic stress gaming addiction causes on a child's brain causes it to overload or short-circuit the brain. This is why a child suffering from gaming addiction has trouble paying attention, following directions, and managing their emotions. Dr. Dunckley says, "It's not realistic to expect the brain to adapt to intense and artificial stimulation it was never meant to handle. It's also not realistic to expect a child with still developing frontal lobe to control their screen time, whether that means managing how long they play a game, how they use or misuse social media, or how they behave afterward." So what actually happens to someone's brain when they're engaged with an electronic device? Essentially, the brain responds like this. The electronic device sends a signal that stimulates the brain. Now, stimulating the brain in general is a good thing. Isolation can be extremely unhealthy for the mind, but like many other things, too much stimulation can be just as harmful as too little. You ever hear about people who die from drinking too much water? Same difference. The stimulation provided by electronic devices causes the brain to get into fight or flight mode due to the stress the device is causing. And the participant may not even be aware of the stress, especially since most adults have learned how to handle stress. What stress does to your body is it constricts your blood vessels, raising your blood pressure and releasing chemicals into your body, such as adrenaline. Constantly exposing yourself to these chemicals in this environment can have long-term health problems, such as heart attack and stroke. Exposing this stress to young children can have not only those same health problems, but can also hinder both their bodies and minds' development as well. Understanding why someone gets addicted to anything is common across the board. The activity puts them in control, gives them a sense of belonging and purpose, and provides challenges and goals for them to accomplish. Those are just some of the reasons why they develop addictions. In a moment, I'll discuss some things you can do, but it's also equally important to not do certain things as well. And this can apply not only to gaming addiction, but any addiction, especially activity addictions, such as gambling and shopping. Things you want to avoid doing are labeling your child negatively. You want to avoid creating any more barriers between you and your child as you can. On that same note, you'll also want to avoid comparing them with either their peers or siblings. An addicted mind, especially a not fully developed teenage or preteen brain, doesn't always process that type of criticism into a motivating trait like it can with an adult brain. Avoid blaming the addicted activity on others who engage in it with them, like their friends. Like our parents' generation, we as parents run the risk of our children knowing and understanding the latest technology better than we do. Regardless of how familiar you are or aren't with modern electronics, you don't have to be Steve Wozniak to utilize basic parental controls and time limits on tablets and consoles. If you have a teenager and feel like they are using the internet to engage in illegal or dangerous activities, I highly recommend parental monitoring software. This is essentially software you install that records keystrokes, and the more high-end editions can even take screenshots, all without the user even knowing. This software keeps records of their online and computer activity, even if they try to outsmart you by deleting their internet history. One thing to also be on the lookout for, mainly with older teenagers, but don't rule out younger children, is the use of an onion router. If you've never heard of onion routing, or Tor as it is also referred to, it's essentially the ability to browse the internet anonymously. One thing to realize is downloading Tor or using it is not illegal in the United States or most countries. It is, however, potentially dangerous due to the ability for other users to communicate with your child anonymously. Tor is like a gun. In general, it is not necessarily a bad thing, and a lot of good can come of it. However, it also gives people the opportunity to conduct illegal activities, such as buying drugs, selling sex slaves, hiring professional killers, stuff of that nature. You're probably asking, if it's that dangerous, shouldn't Tor be illegal? Not really. In fact, the very concept and practice of onion routing is actually essential and necessary for many people around the world. This is a tool that allows people in oppressed countries, such as Iran and China, to communicate with the rest of the world. These countries and other oppressive ones typically block many websites and domains in an attempt to control their population. The majority of Tor users don't use it for illegal practices. But that's getting off my original topic. My point is Tor, when used properly by adults, is perfectly fine. However, I would steer clear of allowing any child to use it for any reason. Not necessarily because of what they will do, but what others could do to them. The dark web is not somewhere you want your child exploring in any scenario. Like with other substances or behaviors that can also be addictive, such as alcohol and gambling, not every single person who engages in these behaviors will develop an addiction for them, but many will. And it's equally important to remember that children don't have the maturity or brain development to recognize these addictions, let alone combat them. Even grown adults who suffer from addictions don't always have the ability to combat them alone. For the first time, millennials are becoming parents. This is the generation where most of them grew up not knowing a world without the internet. No doubt many will dismiss the concerns covered here as being blown out of proportion. Many millennials probably think, I grew up with video games and I turned out fine.
You know, I think millennials just adapted the technology much better. I think there's the new generation Z, I guess they're even more savvy with the technology. So again, it's not to make it a harmful thing, but if parents are actually coming to me with a problem with their child, I think then what we usually do is sort of a family assessment. I do a lot of, and I write about family therapy and where it's really everybody's sort of in it. It's not the identified patient being the child. It's sort of like an eating disorder. I mean, in and of itself, food isn't bad, but making healthier and unhealthy choices about food. I mean, are you going to have that big bag of potato chips, or are you going to have some fruits and vegetables today? It's like that with technology. It's really not to blame the technology, but it's to put it in some context. What are the healthier ways of using it in your home and for your child? So that usually is a better way of approaching it. It's very much like going on a digital diet, or I talk often about digital nutrition and making healthier choices. Because when you look at it, it's the same thing as food. You're not going to abstain from food as part of the treatment like you would say with drugs or alcohol. So the outcomes have to be different. It's about balanced and healthy use and trying to find measures for that. And sometimes that's very unique per family.
So green time is basically exposure to the outdoors, nature, greenery in particular. So what happens with the nervous system when the eye sees greenery is that it grabs our attention, but it lowers the stress response. So with screens, it grabs our attention, but it raises the stress response. And with greenery, it grabs our attention, but lowers the stress response. So actually, it restores attention. And we know from studies that children who are exposed to more green spaces actually start getting better grades. They're less likely to get in trouble. Even in the inner cities, we see that children who move to an area that has more trees around their building, for example, they're less likely to have delinquency issues and their grades go up. So even pictures of greenery can help. So, these days children aren't going outside nearly as much as they used to. So that's compounding the problem.
There's a reason that the most tech-cautious parents are tech designers and engineers. Steve Jobs was a notoriously low-tech parent. Silicon Valley tech executives and engineers enroll their kids in no-tech Waldorf schools. Google founder Sergey Brin and Larry Page went to no-tech Montessori schools, as did Amazon creator Jeff Bezos and Wikipedia founder Jimmy Wales. Technology is something that's done many great things and will continue to improve our lives, but we mustn't let it also destroy them. If you think your child does have a gaming addiction, please check out the links provided on the screen to learn more. I hope this film has proven useful for you. Just remember that nobody has ever said on their deathbed, I wish I had spent more time on the computer.